A recent survey of registered voters raises some serious concerns about how Americans are experiencing the healthcare system. Americans are feeling the strain of inflation. As the prices of food and other essentials rise, a majority of voters are simultaneously feeling the burden of increased healthcare costs. A top concern for voters? Out-of-pocket costs. Rising out-of-pocket costs have led many to skip or delay treatment they need. Americans are frustrated by the unpredictability of these out-of-pocket costs and unexpected bills, and feel like insurers are nickel and diming them. With half of those we surveyed saying their finances or those of someone close to them have been seriously affected by medical bills, it's no wonder these concerns with out-of-pocket healthcare costs are so prevalent. Nearly 2 in 3 voters say they personally, or someone they know well, have had medical bills go into collections, including 80% in financially unstable households. The need for more mental health care services has also never been clearer. Even though mental health parity is guaranteed by law, insured Americans can't get the mental health care they need because they can't afford it, and they can't find providers in their networks. Nearly 7 in 10 voters under 50 and almost half of voters over 50 say it's difficult to find mental health providers due to cost and lack of insurance coverage. 54% strongly support additional access to mental health services, and 88% believe insurance should cover mental health care. The results are clear. More Americans have healthcare coverage than ever before, but the steep prices they still have to pay for deductibles, premiums, and other out-of-pocket healthcare costs are a huge burden. 77% of voters think the federal government should ensure that all Americans have access to affordable, quality healthcare coverage. And 69% of voters say they would be more likely to support a political candidate who made reducing healthcare costs their top priority. Bringing down healthcare costs would be a winning issue for elected officials and candidates from any party. Americans support capping insurance deductibles to make costs more predictable and prevent medical debt when receiving the medical care they need. Junk insurance plans that cover little and place a disproportionate financial burden on patients should also be prohibited from the market. Voters also feel strongly that insurance should cover mental health care and ensure that it is affordable. There is a real need for meaningful reform, and it is critical that our nation's leaders use their power to support Americans by bringing practical solutions to the table and eliminating barriers to care. Learn more at consumersforqualitycare.org/research.